Hello and welcome to Lone Star College North Harris Associate Degree Nursing Program Information Session. I am Juanita Armendariz, Academic Advisor for Nursing at Lone Star College North Harris. The Lone Star College North Harris Nursing Program is housed at the Health Professions Building off of Red Oak Drive and Peakwood Drive behind the HCA Northwest Medical Center. What is nursing? We took the most current definition of the 2010 edition of the American Nurses Association Social Policy Statement to define nursing. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and population. Where do nurses work? Nurses work in hospitals, clinics, doctors' offices, schools, home care, long-term care facilities, occupational settings, community, military, and so many other areas. 2 tracks are offered for the completion of the Associates of Applied Science and Nursing at Lone Star College North Harris. We offer the articulation track, which is a transition track for current LVNs and certified licensed paramedics. This is a 3-semester clinical program and it starts in June. The other track is a basic track. With this track, you don't have to have prior healthcare experience, and it is a 2-year clinical program beginning in August. The Lone Star system offers 2 curriculums in nursing. We offer the integrated and the block curriculum. The integrated curriculum is offered at North Harris, Kingwood, Montgomery, and Tomball. The block curriculum is offered at Cy-Fair. The integrated curriculum is a program organized around a series of concepts that progress from simple to complex, whereas the block curriculum, their program courses are divided by content areas such as children, families, and adult health. Lone Star College North Harris Nursing Program weekly schedule. The program is a daytime program and you're generally busy 3 to 4 days out of the week. You will be busy for lecture 5 contact hours, lab 3 contact hours, clinical can range from 10 to 12 contact hours a week, and then you will also have tests. Here is course content covered in the program. You have role of the nurse, perception psychiatric, heart lungs, pregnancy newborn, diabetes nutrition, etc. The teaching methods used in the Lone Star College North Harris nursing program are the following. In lecture, instructors use PowerPoint, visual aids, D2L system, which is the Lone Star online system, and readings. In lab, students will have hands-on skills training, use of simulated mannequins, and videos. For clinical, students will have direct patient contact at area hospitals and long-term care facilities. They will also be doing clinical logs and care plans on their patients. There will also be projects. There will be individual and group projects, research papers, posters, presentations, etc. The exam schedule for the Lone Star College North Harris nursing program is the following. Lab tests are weekly before each lab begins. Lecture tests are before lecture. Dosage calculation/math tests are before lecture. Please note, you must pass the clinical, lab, and lecture components of the program with a 75% or higher in each section in order to progress to the next semester. Students will have to pass a math component with the 90% or higher in order to progress in each semester. And for the math exam, you will have 3 attempts to be successful in the exam. If not, you will be withdrawn from the program. Other program information. Please keep in mind that there is no formal math course taught during the program. It is important to refresh math if needed prior to application and program start. Anatomy and physiology and medical microbiology, please do well in these courses because the instructors do expect you to know this knowledge. Pharmacology, which is RNSG 1301, it is strongly advised that you complete this course before starting the nursing program. Getting started. Students must first have applied to Lone Star College, unless you're already a current Lone Star student. Submit official transcripts from all non-Lone Star College system schools attended. Meet with the LSC advisor as needed to ensure you have declared nursing as your intent/plan and to discuss nursing program requirements. You can find nursing program information on the Lone Star College system website and also through the Lone Star College North Harris Nursing Program website. Please see both if needed. LSC North Harris application periods and deadlines. All nursing applicants will need to submit an application online. Go to the following website, https://www.lonestar.edu/nursing-requirements.htm. On that page, on the subheading Apply, you will find the instructions on how to apply and the link to apply. Make sure that the following documents are in PDF format, which are the supporting documents. A signed FERPA form, a credit advising transcript, and proof of hepatitis B quantitative titer. Application deadlines can be found at www.lonestar.edu/13465.htm. Acceptance and denial letters will be sent via email to your My Lone Star email account. Basic track admissions criteria. Prior to application, the following courses must be completed with a GPA of 2.7 or higher and at least a C in every course. The courses are Biology 2401, which is Human Anatomy and Physiology 1, and English 1301, which is Composition and Rhetoric 1. These are the two prerequisite courses that must be completed and graded, and they cannot be in progress to be able to apply. Other required courses for the basic track. These courses can be taken within the program or before you start the program. They are Biology 2402, which is Human Anatomy and Physiology 2, Biology 2420, which is Microbiology for non-science majors, Psychology 2301, which is General Psychology, and an elective. This elective has to be 3 credit hours, and you can choose from Creative Arts, Language, Philosophy, and Culture options. Please refer to the Lone Star College course catalog. Also, you must have at least a grade of C or higher on all academic courses. Articulation Transition Track Admissions Criteria. Prior to the application, the following courses must be completed with a GPA of a 2.7 or higher and at least a C in each course. Biology 2401, which is Human Anatomy and Physiology 1, English 1301, which is Composition and Rhetoric 1, and RNSG 1301, which is Pharmacology. All courses must be completed and graded, not in progress at time of application. Other required courses for the Articulation Transition track are Biology 2402, which is Human Anatomy and Physiology 2, Biology 2420, which is Microbiology for non-science majors, Psychology 2301, which is General Psychology, and an elective course that has to be 3 credit hours. It can be chosen from creative arts, language, philosophy, and culture options. Refer to the Lone Star College course catalog for this. Also, these courses can be taken within the program or before starting the program. You must have at least a grade of C or higher on all these courses. Biology Pharmacology Refresher Information. Required biology and pharmacology courses completed more than 5 years prior to application to the nursing program must be refreshed. Options to refresh Biology 2401 and 2402 courses include Biology 2404 as the Biology 2401 and 2402 refresher, repeat individual credit courses for a new grade, and then option to refresh pharmacology is just to retake the course.
HESI Admissions Assessment Exam. This is a nursing pre-entrance exam that applicants are required to take. 6 sections are required that the applicant complete from that exam. The sections are reading, grammar, vocabulary / general knowledge, math, anatomy and physiology, and critical thinking. The exam is offered throughout the year at LSE campuses. You can only take the exam at one LSE campus once every 60 days. And if you retake the exam, the most recent set of scores will be used for admission purposes. Study guides are available on reserve in LSE North Harris Library or for purchase throughout the LSE bookstores, online, or other vendors or retailers. You can find more information at www.lonestar.edu/HESI-test.htm.
Basic track ranking criteria for admission. This admission criteria will be effective December 2025. On this admission criteria, there are 4 sections with the max points of 9.6. In the first section, the average of the GPA in the Human Anatomy and Physiology 1 or Human Anatomy and Physiology 2, whichever grade is higher, and the English 1301 will be looked at. So you will calculate the GPA of those 2 courses, and that's how many points you will receive in the first section. In the second section, the HESI entrance exam will be looked at. You have to complete the 6 sections and then average out the first 5 sections and divide it by 25, and that's how many points you will receive in the second section. In the third section, you will receive points or be deducted points depending on the grade that you make in Human Anatomy and Physiology 1, Human Anatomy and Physiology 2, Microbiology, and Pharmacology. In the fourth section, the overall GPA at Lone Star College will be looked at. So if you have a GPA of a 3.0 or higher at Lone Star College, you will receive points. If you have lower than a 3.0, you will not receive points. So then you go back and add up the points in each section for a total score. Basic track nursing courses. Here you have an outline of the courses you will be taking once you're admitted into the nursing program. Our nursing program only starts once a year in the fall, so you can see that you'll be attending fall, spring, and then summer is an option. So it's an option to take a break or to go ahead and do the vocational nursing. And then after that summer, you will then attend fall and spring. Articulation transition ranking criteria for admission. This admission criteria will be effective December 2025. In this admission criteria, there will be 4 sections with the most possible points of 9.6. In the first section, the GPA of Human Anatomy and Physiology 1 or Human Anatomy and Physiology 2, whichever is highest, the English 1301 and Pharmacology will be looked at. You will take that GPA, and that's how many points you will receive in the first section. In the second section will be the HUSI entrance exam. You will complete the 6 sections, and then you will average the first 5 sections and then divide it by 25, and that's how many points you will receive in the second section. In the third section, you can receive points or be deducted points based on your grades in Human Anatomy and Physiology 1, Human Anatomy and Physiology 2, Microbiology, and Pharmacology. In the fourth section, the overall GPA will be looked at Lone Star. So if you have a GPA of a 3.0 or higher, you will receive points. If you have lower than a 3.0, you will not receive any points. So then you will total up each section for a max score. Articulation/transition track nursing courses. Here you will find an outline of the courses that you will be attending after you have been admitted to the transition track. You can see that the program starts in the summer, which is June, and then you will also attend fall and spring for a 3-semester clinical program. Hepatitis B titer. At time of application, the student must submit proof of the hepatitis B titer. In order to be in compliance with the clinical site requirements, applicants must provide documentation of a quantitative hepatitis B surface antibody immunity titer completed within the past 3 years that reflects immunity to the hepatitis B virus. This lab result must be submitted at the time of application. The hepatitis B titer is a blood test that validates an individual is immune to the virus. Lab reports simply stating negative or positive are not accepted. If hepatitis B surface antibody immunity titer demonstrates a lack of immunity to hepatitis B, students must provide all the following with your application. They must provide documentation of the previously completed series of 3 immunizations, the original lab report of the titer, and evidence of at least the first booster shot in the next series of 3 to 4 immunizations after the negative titer. Application submission. Application deadline is in April for the basic track and March for the transition track. The LSC system office processes the applications. North Harris accepts 100 students each year for the basic track and 30 students each year for the transition track. Things to expect after you have been accepted for admission or as an alternate into the program. After acceptance into the nursing program, there will be a mandatory orientation. For basic track, it will be in May, and transition track will be in April. Background check. Once accepted into the nursing program, all students are required to have a satisfactory criminal background check through the Texas Board of Nursing prior to formal acceptance in the nursing program. The background check cannot be done before being conditionally accepted. Any student who has a felony or misdemeanor conviction must have approval through the Board of Nurse Examiner's declaratory order process. This is done once the student is conditionally accepted. Eligibility for clinical and licensure. Nursing applicants must answer these questions in order to be eligible for clinical practice in conjunction with education programs and for the eventual licensure in the state of Texas. There are 2 distinct types of questions. They are criminal offense questions and chemical dependency questions. Completion of associate's degree nursing programs does not automatically qualify graduates for the licensure examination by the Texas Board of Nursing. Please view the Texas Board of Nursing for more information. Social Security number or visa. Although not a requirement for admission into the nursing program, our clinical sites require students to have a valid Social Security number or a valid international student visa as a condition of being assigned to that site. Students who are unable to complete the LSCS Health Program Clinical Skills requirement will not be able to complete the program due to a lack of clinical placement. Estimated cost of nursing. For current fees, please visit the following website: lonestar.edu/nursing-program-cost.htm. Fees are subject to change. LSC Campus Resources. You have resources such as admissions, advising, registration, learning centers, tutoring, placement testing, counseling, career exploration on the LSC campuses. For more information, please go to lonestar.edu/student-services.htm. Furthering your education. The associate's degree is the first degree in becoming a professional nurse, and many employers, as well as the Robert Wood Johnson Foundation, encourages the advancement of nursing to seek higher levels of education. This may be required to obtain a position, especially if the hospital is seeking magnet recognition. LSCS has many affiliation agreements, which allows for easy transition into a BSN program. This slide holds additional course requirements for most BSN programs. Please look over the requirements. This is a guide only. The student is responsible for verifying program requirements at his or her prospective university. Some universities may also require completion of a literature and/or computer literacy course. University nursing degree program websites. Here are some websites for a four-year institution that have the ADN to BSN program for you to consider. This concludes the presentation. My name again is Juanita Almendares, Academic Advisor for Nursing at Lone Star College North Harris. On the slide, you will find my contact information in case you have any questions. Good luck to you.